My history is I've been in nursing education since 1993. I started when I was really young. My background is I'm a labor and delivery nurse out of Atlanta, Georgia. Got transported to the South with a blind date where I met this great man who's been married going on 25 years. So don't ever say never, because you'll never know where you end up in life. Okay? So Coastal Pine Technical College has developmental approval to move forward with their RN program. So what that means for you is that you may start your core classes to begin moving forward for this program. The first program of nursing classes, the intake will start January of 2020. Okay, so that means we're giving you a year to get all of your core classes completed for this program. The estimated enrollment for this first class, they're looking at taking in 40 students. Okay? It is a competitive admission process, so we're going to talk about that process today so that you've made sure you have done everything necessary to be in that competitive pool. Okay? One of the reasons that it is competitive is because we're in a nursing shortage. Okay? And we need the best of the best. Okay? Coastal Pine wants this first class to outshine every other class in the state of Georgia. Okay? So the top 40 of this intake will be in that first class. Okay? To start the program, you need to make sure that you first filled out an application with Coastal Pine Technical College. I believe it's a $25 application fee. If you have been enrolled before, you will not have to pay that fee again. So if you've taken a class before in any technical college across the state of Georgia, you won't have to pay that application fee again. Okay? So the first step would be to make sure before you leave today that we have an application ready for you. Okay? They're then going to ask you for a copy of your driver's license or birth certificate. We need to make sure you're really who you say you are. Okay? We also need a copy of your high school transcript and any other college that you may have attended. We will need a copy of those transcripts as well. Okay? They can be delivered to any of your Coastal Pine locations. Okay, so you say, well, I'm only going to come here and do nursing, but I may do my core classes over in Waycross. That admissions office can take your application. They can take your transcripts as well. Any of the locations can do that for you. Your transcripts do have to be sealed. Okay, so if you've gone and picked them up and they look like the dogs chewed on them, they're not going to take them. Okay, they have to be in a sealed envelope to prove that they are truly the correct transcripts. Okay. After that process is started and you've taken an admission test to the college, they will take your acupuncture scores, they'll take SAT scores. If you've got some old asset scores, they can look at using those as well. If you've not taken an admission test at the college, then you will need to sign up to do that. Okay? In the admissions office, they will have the scores that you have to make on each of those admission tests to be accepted into the associate degree level core. Okay? This is an associate degree in nursing. What that means is that it is your entry level. Okay? Entry level means that you take the licensure exam for your NCLEX state boards at your entry level programs. Okay? Your associate degree programs are usually about 1.5 years in length, and that includes your core classes. Okay? Your BSN programs are about 4 years in length. Okay? Your difference is, as you know, we're a technical college system of Georgia, so our goal is to put you to work. So as an associate degree graduate, you gain the skills necessary for you to start work upon graduation of this program. Okay? The program will articulate to other BSN programs after they receive their ACEN accreditation. Okay? ACEN accreditation is the National Nursing Accreditation for nursing programs. Okay? So those things are yet to come for Coastal Pine. Okay? So what can you sign up for now? Okay? The courses required for this nursing program include English, okay? Associate degree English. So if you're a LPN student or an EMT student that is at the diploma level, the English that you've had is not at the right level. So you have to take the associate degree core classes. So that would be your English, You have to take algebra, okay, for this course. We get a lot of feedback on that sometimes when people say, why do we have to take algebra? Well, guess what? Y'all cannot delete your mistakes on a computer. When you make a math mistake and you give 20 milligrams instead of 2, you kill your mistakes. You kill people, okay? So we've got to know that you have the math skills to set up a ratio proportion, and do not tabulate your medications wrong, okay? Because we don't delete our mistakes and just go back. We kill people when we make mistakes in the nursing field, okay? Another core class required is a psychology class, and that's to bring in a little bit of the mental health aspects and the Bloom's taxonomy on how do you learn, and also Maslow's hierarchy. So you'll have a basic psychology class at the associate degree level. You're then required to take A&P, both 1 and 2, and those come with a lab as well. Okay. You will also be required to take a microbiology class. All this is in that packet, as some of those give that deer in the headlight look. Also, there will be a required humanities class. Now, in that means you can actually take the humanities course itself, or you may take music. They will offer both of those 2 classes at any of their locations for you to take. And then the last thing is a gen ed elective, and that can be a second English, that can be a history, that can be another psychology, okay? Those are your basic core classes required, okay, to start in that first class in January 2020. All of those, this is a ding, ding, ding moment, okay? All of those are required, and they have to be completed by the deadline of September 27th, which is in your book. Okay? So that's why we're reaching out to you now, okay, for fall semester, okay, of 2018. Okay? Because you can't take A&P 1 and A&P 2 at the same time. Okay? So you need to be getting into A&P 1 for fall, A&P 2 for spring, microbiology for summer, so you're making that September deadline, okay? So let me say that again. If you're ready to start for January 2020, you need English, algebra, and A&P 1 for spring semester. So when you see Ms. Kelly to sign up for nursing courses, those are the 3 first courses that you need to put on your list, okay? There is a time limit on your algebra courses and all of your biology courses. Your biology courses include your A&P 1 and 2 and your microbiology. They have to be within 5 years. Okay? So if you're transferring some things into us, let's say you took them at another technical college or a university system, already taken algebra, you've already had A&P 1, as long as they're within 5 years, you don't have to repeat them. Okay? If they're over 5 years old, you will have to repeat those courses. Yes, ma'am?
As an advisor, the current way that things are going into our system. Let's say that a student took the class in 2013.
Okay.
She sent her transcripts to us in 2016. In our degree works, it's showing 2016, although the course was in 2013. I ran into that yesterday. That is a system problem. So what are, as advisors, what are we to do about that?
As advisors for the admissions area or advisors for nursing?
Nursing.
Okay. The advisors for ASN should be the ASN instructors only. There's 2 hired at this point. That's Ms. Kelly, who I have over here, and Rebecca, who will be joining us this afternoon. In degree works, when they pull that student's data up, they've got to go and look at when the course was actually taken. It does not go from the time you receive the transcript. It's when did they actually take that course. I think there's a way, and I'm thinking, in degree works where you can flag those courses that have a 5-year time limit to make sure that they've actually looked at where the course, when the course was taken, and not when the actual transcript came in. Does that help?
Yes.
Okay. Other questions at this point? Are you overwhelmed already? We just got started. No more questions now? So you've got those core classes that are required, okay? Your deadline is September 27th, okay? So let's say you take English, Algebra, and A&P1 for this coming fall. For spring, you can then pick up that Psychology, A&P2, and your Humanities course if you want. And then in summer, all you have left is your Microbiology and the additional Gen Ed course that you choose from. Okay? So it's a pretty laid out system, but we needed you here now so that you can get started this fall on those classes so that you will be ready for that January intake. Okay? Once you have completed the second A&P and your English and your Algebra, you will have to take what we call a HESI admission test. Okay? It is different than the admission test you would have taken to get into the college. Okay? It is a nursing admission test, and as a generic student, it's going to test your knowledge over your English, over your Algebra, and over your anatomy courses. Okay? You will be required to make a 75 composite score in each of those 3 areas. Okay? You may take the test twice to get that 75 composite score in each section. Let's say you take it twice and you didn't make the score in the anatomy, but you made it in the English and the math. Then you have to wait a year before you can test again. Okay? So after you take it though 2 times, trying to make the 75 composite score in each section, you have to wait a year after that second time before you can test again. All right, and that's to provide you with some remediation time. All right, and what that tells us is the 75 is the minimum score on that test that tells us that you have a minimum competency in those 3 areas. Okay, it's very important for nursing that English, we make you take it so that you know how to walk, not walk, I'm walking, so that you know how to talk and walk at the same time probably, where you can talk, write, and speak and communicate with your other nurses and your other physicians. Okay? We make you take math so you won't make a drug count problem. We make you take anatomy of every system because when you get into your nursing courses, they will not go back and teach the anatomy sections. Okay? So if you're not making that 75 composite score, that tells me you don't have the minimum competency in those classes to be successful. So you're going to need that year of remediation to bring those scores up. Yes, ma'am?
I took the HESI test before. Is there a limit? Because I was in a nursing program before. Like, can I transfer those scores?
Scores are only good for 2 years, so I don't know how old your HESI scores are. If they're over 2 years, you would have to take it again.
Okay.
Okay. And let's talk about being in nursing programs before. I'm not saying this is your situation, so I don't know your situation. If you have been in a nursing program before and failed out of any nursing course at any other nursing program, you may not enter this program for 5 years. So if you fell out of a nursing course at another nursing program, there is a 5-year limit before you can return. Okay? And that's pretty standard across the entire state of Georgia. Okay? I have students all the time where I work that'll say, hey, I'm calling, but I wasn't successful over there in East Georgia. And I'll say, well, what did you fail? Fundamentals. I'll see you in 5 years. Okay? So just know that. You will be allowed the opportunity as the curriculum develops, okay, and they continue to develop that curriculum, they'll let you know how they plan to use testing instruments throughout the courses, throughout that program, okay. But right now, your important thing is to make sure that you've got those core classes lined up, that you know that after your second anatomy and physiology class, you have to take the HESI entrance exam 2 times. 75 composite score on each section. Don't ask me the price, but I want to say somewhere between $55 and $65, but don't quote me that price, okay? Somewhere in that ballpark, okay? Nursing is also a field that if you've had any type of criminal background activity, we probably need to talk, okay? If you've been arrested for a felon or a misdemeanor, okay, your clinical facility sites that will be utilized for this program makes the decision on your background check if they will accept you as a student there to perform clinical. So you need to know that if you have some of those things in your background, there is a chance that that clinical facility site will not accept you as a student. okay? The college itself does not make that decision. That decision is made by your clinical facility sites when they evaluate your background, okay? Let's say you did have a felon, it was 12 years ago, you've been allowed to do your clinical, you've graduated from the program. You also need to know when you get ready to take your NCLEX examination at the state board level, they're going to ask you on that application, have you ever had a felony? Please don't lie, okay? Check yes, because they're going to run a background check. And when you lie, that only gets you in trouble when you actually get a $500 fine for falsification of documentation from the Georgia Board of Nursing. So on that application, if you've got a felony or misdemeanor, mark yes. And all you have to do is supply all the documentation to go with that application to explain it, okay? We know sometimes you go to college that first year, you party a little bit, you might have been in the car, somebody got arrested, you got arrested too just because you were in the car, so things like that happen. So they will look at each individual case separately. But the best bet is stay clean, don't get in trouble ever. Don't get in trouble after you get your RN license because they can restrict it. And they can take it back from you, okay? Nursing is a profession, okay? Nursing is a profession, let that sink in. Okay? Nursing is not necessarily what I say, just a job or a career, but it's a profession, okay? The difference is in a job and a career, and there's nothing wrong with this because I started out as Burger King flipping hamburgers when I was 16 years old, but that was my job, okay? My profession now is nursing, okay? And you better choose nursing because you have a love for people, okay? This nursing program is not for you if you're here because mama said, honey, I want you to be a nurse, okay? Or if husband said, hey, you need to go make some good money, so let's go be a nurse, okay? Or you've watched Grey's Anatomy for 10 years now, you've seen every bit of it on Netflix. You've watched every season of Grey's Anatomy on Netflix. I'm going to tell you, the nursing role is not what you're seeing on Grey's Anatomy, okay? So if you think it's like that, it's not, okay? Your feet are going to hurt. Your legs are going to hurt. You're going to learn how to hold your bladder for over 8 hours at a time, okay? You're going to learn how to eat very quickly so that you can get back to your patients, okay? But it's the best career choice you will ever make. You make a difference in somebody's life every single day as a nurse when you show up for that profession. It'll be the small things that you won't realize that make the difference till your day is over. Okay? So if you have a love for people and a love in your heart for caring, then you're in the right room today. It is not going to be easy. I've been in education since 1993. Nursing is not an easy course. I'm not going to stand here and say, oh, it's a piece of cake to walk in the park. It's not. It's hard. It's going to take dedication. And it's going to take, by the time you do your core and you get into nursing class, it's going to take about 2 years of your time total. Okay? But you're going to be 2 years devoted to Coastal High Technical College. Okay? So what does that mean? That means there's going to come a Thanksgiving dinner, and you're going to eat your turkey, but guess where you're going afterwards? Back to your room to study. The Georgia Tech game is going to come on that Saturday morning or Saturday afternoon. You're not going to get to watch it because you're going to be what? Studying. Christmas is going to come. You're going to open your presents and then you're going to be back studying. Okay? My students laugh when I tell them that on orientation day. They're like, that woman doesn't know what she's talking about. And by the end of their time, when we pin them at the end, they come up and say, you know, we thought you were crazy, but you were exactly right. I ate my turkey and then I was studying. So it's going to take dedication from you. Your core classes are going to be the simplest thing you do. Okay? So you're in your core classes, those are the simplest things you will do in this process. Just remember that. Okay? Now here's the key on those core classes. All those core classes have to be finished by when? September of next year. Okay? All of those core classes that we just talked about, English, algebra, psychology, A&P 1 and 2, microbiology, humanities, and one more gen ed class have to average, you ready? A GPA of 2.8. Stick that in your head. An average of a 2.8. So what that means, you're not going to get many C's. Okay? For every C you get, guess what you have to offset it? An A. Okay? So for every C you get, you're going to have an A to offset it. Okay? I'll give you a true scenario. Had a student came in. She had beautiful B's, 1 C in a course that had more credit hours, okay, than some of the other courses she had taken. She didn't make her 2.8. Okay? So when you have a C, you got to have an A to offset it. Okay? Your core classes that carry the higher credit hours are the ones you don't want your C in. Your algebra is going to carry more credit hours than the lab of the A&P. Okay? Your A&P class is going to carry more hours than the lab. So if you have to get a C in what? The lab, because it doesn't carry as much credit hours. Now, I prefer you didn't get any C's, but if you got to get a C in the course that carries the less credit hours, and then it doesn't tabulate as much when it rolls into your GPA. Okay? Questions about the GPAs? So we're not taking all of your core classes in every college that you went to and averaging them for your GPA. What are we averaging for your GPA? Just the core classes from Coastal Time that are required for nursing. English, algebra, A&P 1 and 2, psychology, humanities, microbiology, gen ed elective. 2.8. Questions? Once you start your actual nursing courses, you will be identified and mailed an acceptance letter from the admissions department here. And that deadline, I believe, is sometime in October. It's in your packet there. In that acceptance letter, you will get a copy of what is required for your physical. You'll get a copy of what's required for your criminal background check, and also what's required for your drug screen. All of that will come out to you in October once you're accepted for the program. Okay? And then you will have ample time to get that completed before you'll have your orientation day for the program. Okay? The reason that information is not provided to you today, it is discussed a little bit in your packet, but it's not provided for you today because there's a time limit on when we want that drug screen drawn. Imagine that, huh? There's a time limit on when we want your criminal background check ran. Okay? And then there's also, if it's flu season, we got to have current flu. So we don't want an old flu shot. So all those kind of things will come out to you once you're accepted into the program. Okay? Please know, let me say this loud and clear, this program is a proposed program. It's under developmental. Okay? It's what we're doing now is developing the nursing courses. It will be given the next level of acceptance once the Georgia Board of Nursing comes and visits the site, which will be in spring of next year. And then y'all will begin your courses in January of 2020. It is not granted full approval by the Georgia Board of Nursing until the first class graduates and has an 80% or above on their NCLEX examination. So that first class that graduates from here has to have 80% board passage rate to grant Coastal Time full approval. So now they're in developmental. They'll move into initial once they make their visit in spring, and then full is granted when the first class graduates with an 80%. At that time, your program will also be going through the ASIN accreditation process, which means you would be graduating from an accredited institution for nursing courses, which means those nursing courses could articulate into BSN programs. So that process will start here in January as well. So they have a lot of stuff that's going on behind the scenes to get the courses ready for you.
January 2020.
January 2020 will be the first intake of classes. So we're giving you this time to get your core classes. Now I know what you're thinking, and you haven't asked it, and y'all getting a little shy this morning. You're saying, well, why do I have to have all my core classes completed by September if I'm not going to start till January, right? Are y'all thinking that yet? No, you haven't thought about that? The reason why is this nice admissions office, they're going to need a semester to work files. Okay? They will have to work the files. They'll have to tabulate the GPAs. They're going to call and say, hey, we still don't have your driver's license. okay? Hey, here are your HESI dates, and you haven't taken the HESI, okay? In your packet, you'll see the months at which the HESI will be given. The exact dates have not been established yet for next year, but you'll see the first one will be in July. And that date will be posted out on the webpage, out on social media. I'm sure emails will go out to you as declared majors for nursing, so you won't miss those HESI dates. So you have that semester there, so admissions can tabulate the scores and let Ms. Kelly know what the highest and the top 40 students are in that intake. And so that's why that's set up like that. Other questions? Once you get into the program, you'll notice on the advisement sheet in the back, it talks a little bit about the nursing courses that are under developmental for this program. I'm sorry, yes.
So y'all are going to offer the core classes for the nursing program here, or we have to take those?
You may take them at any of the Coastal Pass locations.
And we are offering,
Or you can take it from any other college. Let me say that. You can take these core classes from any other college and have them transferred in. You just got to make sure that you have them transferred in and that you have filled out a Coastal Pine application by that September 27th deadline. Now, I'm going to say this. I'm a big TCSG girl. I've been with them since 1993. Why would you want to go pay more than close to $80 a credit hour to take a class when that other place is going to charge you a lot more than that? So I'm just going to throw that out there. We have the cheapest tuition anywhere in the state of Georgia when it comes to taking core classes. Okay? So think about that, especially if your mom and dad are picking up this bill. Okay? But you may transfer those classes in. Yes, you may.
and I also wanted to say, we will be offering Anatomy 1 and 2 on this campus beginning in the fall. Micro will be, all of the core classes will be offered on this campus also. I don't know if micro is going to be offered in the fall, but more than likely in the spring. If we do anatomies in the fall, we'll do micro in the fall. But, I mean, in the spring. So it'll be here. If not on this campus, for sure on the Waycross campus.
Also know that those classes are offered in all formats. You may take your English algebra online. You may come to the traditional classroom. You can do it half and half. Okay? Usually your Anatomy 1 is not ever offered online. Okay? Because why? Well, it's got the lab component, but Anatomy 1, we want to make sure you got that core base before we give you the option of taking it online. Okay? So you'll have some schools that A&P 1 has got to be taken in a traditional classroom with the lab. A&P 2, they may put the class online and you only come in for the lab. That's up to each individual college on how they decide to teach that course. Microbiology, the classroom portion can be taught online and you only come in for the lab. All of that depends on the college at which you take that at. Okay? But for them to have initial developmental approval for the nursing program, they had to be able to offer all of those core classes on the Coastal Pines locations. And they have many locations, so you can take them at any of their locations. So if you look at the nursing classes, I'm sorry, yes?
I work in admissions here. We've had several people ask about whether our RN program is going to be a bridge or a traditional. Can you address that?
I can. The current program that has been granted developmental approval is what we refer to as the generic program. Okay? That means anyone that's had no medical experience can enter it. People who are CNAs can enter it. Students out of high school can enter it. Those coming back as a second career can enter it. LPN students can also enter the generic program. It's not a bridge. Now, I will kind of speak and let you know that Dr. Dybert does plan to extend that and possibly do a bridge later, but the Georgia Board of Nursing will not give you developmental approval for a bridge program right off the bat. You have to start with a generic program, prove that you can be successful with the generic students, and then you go back and ask for your bridge. So I do see that coming in the future, but this first class has got to pass with an 80% board passage rate before they're going to grant you approval to do a second type of nursing program. So a bridge is in your horizon, it's just not right yet. Does that help? Students who want to do bridge can enroll in this. The difference between your generic and bridge is bridge means they're already licensed as LPNs, and their program would be 1 year of nursing classes, whereas your generic program is a year and a half of nursing courses. So the bridge is 6 months shorter usually than your generic program for generic students. All right, so you see you're going to start off with a fundamental course when you actually get into the nursing classes, followed with mental health. So in January of 2020, when you would start nursing here, you would have fundamentals and mental health. Okay? Your fundamental component will also consist of some physical assessment skills. They have combined that in with that course at this location. Did you have a question? Okay. And then mental health. So the clinical associated with those courses is your fundamental course is going to take you to the nursing home. So nursing home is going to be your very, very, very first experience of putting your hands on breathing, living patients. Okay? This is what I tell my students. When you walk in that room and that man says, "Is this the first time you've given a bath?" What is your answer? No. You take a bath at home? Yes, you take a bath at home. So it is not your first time giving a bath. If you've had kids, you've given a bath. Okay? First time you give an injection and they say, "Is this your first injection?" It's not going to be, because you're going to practice every skill right over here in the Jessup Labs. Okay? Dr. Biter has been instrumental in setting up 2 brand new nursing labs for this program. You will have a simulation lab, which will have 3 different types of simulation mannequins in it. What that means is these mannequins talk to you, they blink, they have heart sounds, lung sounds, bowel sounds. We can make them code and die on demand. We can make them birth a baby, because he's bought the birthing simulator, so she will birth a baby for you. She will have a postpartum hemorrhage for you on the spot. We can make them seize, okay? We can make them sweat. We can make them talk, okay? So you'll have a full simulation lab here where you can do up to 30 credit hours of any of your course in simulation, and then you'll have a full skills lab as well. So those are brand new labs that are being built here on the Jessup campus for this program, and a brand new classroom. It's a tiered classroom. It will also have technology in there for you to be able to look at your PowerPoints while they are instructing you. Okay? Your technology available to you at your fingertips is not for you to do your Christmas shopping on while the instructor is talking. Okay? It's for your use in instruction of that classroom. So that first semester, fundamentals in the nursing home, and then mental health will consist if you go into your psychiatric facilities in the surrounding area to learn how to deal with everybody's everyday problems, which can arise from anywhere from depression to post-traumatic stress disorder to some bipolar. So that would be in your first semester. Okay? Each course in a nursing curriculum is going to have that curriculum component, and then it's going to have its clinical component. The clinical days will be a 6:30 to 5. Okay? So those of you with children on your clinical days, clinical will start at 6:30 at whatever clinical institution they've assigned to you, and they're 10-hour clinical days. Okay? Because real life is the nurses really do 12-hour shifts. Okay? So try to get you as used to that as you can. Your clinical day will be a 10-hour clinical day. And another reason for that is because we have so much clinical time that we have to get in a 16-week period of time, or a 14-week period of time, or sometimes your summers are even as short as 10 weeks. So it's just going to depend on where your college is set up. But that clinical time has got to be done within that semester. So that's another reason they do 10-hour shifts. Okay? Second semester, you move into your Med-Surg 1. And you will move into pharmacology, everybody's favorite class. Okay? Pharmacology will have 2 components. Pharmacology will teach you all the drugs you ever wanted to know in regard to your patients. And then its main component is going to focus on drug calculation. How to properly calculate drugs via by mouth, via by IM injection, via by IV. So that would be a lot of your pharmacology course. And then your Med-Surg 1 will have your basic Med-Surg courses. And as your Med-Surg courses build, as 1, 2, and 3 continue, they will get more difficult. And they will get more critical thinking based. Okay? So you'll start very basic in Med-Surg 1, and you might just talk about an MI, a heart attack. Okay? In Med-Surg 2, you might also have some cardiac, but in that one, we're going to talk about congestive heart failure and an aorta aneurysm. And in your Med Surg 3, we'll talk a little bit about cardiac, but there you're actually going to have a cardiac arrest and the mannequin's going to code. And Ms. Kelly's going to hope your CPR is really current because she's going to see if you can bring him back. Okay? So they build on each other. You also see that there's a component of OB and Peds for your third semester. You get a little experience in labor and delivery, mother-baby, and then some type of pediatric experience. Your pediatric experience could be anything from going with a school nurse at the schools, from going to a doctor's office in a pediatric setting, or some of our hospitals actually have some pediatric patients there, so it might be involved in pediatric patients on the floor as well. You'll notice your total credit hours for the program. Okay. Once you complete the program, you will then be eligible to take the NCLEX examination. Okay. As long as you're a resident of Georgia and you take the Georgia NCLEX examination, all students who apply for their very first time now are included in what we call the E-Compact for nursing. The E-Compact for nursing means that once you have a Georgia license for the first time as a new applicant and you live in the state of Georgia and you get licensed, it's good in 30 other states. And what's important about that is prior to this, anytime I worked in Georgia that I might want to step across the Florida line to do a little nursing, I had to ask for reciprocity in that state, which cost you another $200. Okay? With the Nurse Compact, now that you're licensed initially, it will license you in 30 different states that you may move in between with no additional cost in work. So that's kind of a new plus out for Georgia Board of Nursing. Yes, ma'am.
Get your license, do you let them know you want to get compact license?
Right now, everybody in the state of Georgia that licensed initially gets the compact.
Okay.
Now, if you're old like me and just was licensed 100 years ago, I have to go back and ask for it. But all the new grads coming out automatically are licensed for the compact unless you have some type of disciplinary action, and then they're not going to license you as a compact nurse. They're only going to license you for one state so they can keep a better eye on you. Other questions? Also in your packet is your FAFSA information. If you've not filled out your application for your federal availability of resources, this tells you how to do it. It also gives you their college code that you will need to file your FAFSA. FAFSA needs to be filed now if you're going to school in the fall. Okay. Also on their website, they have opportunities for scholarships, so please look at their website for those opportunities for scholarships as well that are out there. I would foresee that as this nursing program grows, that you will see more nursing scholarships that will start to be offered. Okay? Those are things that they will reach out to the community for. I know in our needs assessment, when we talk to the different clinical facility sites, some of them have already agreed to set up some scholarships for nursing. So it's just a follow-up on those. So you should start seeing more nursing scholarships. Yes?
So y'all said that y'all were going to get the more classes for, like AMP and micro?
Yeah, they're ready now.
They are ready to now?
You can sign up today. Yes, ma'am.
Fall?
Yes.
Okay, awesome.
Like taking August 20th is when classes start. So we don't want you to leave today. If you're a current Coastal Pine student and you're nursing, we need to first make sure that that major has been declared in admissions. I'm not sure what they're putting you under right now, but they know. When you go in there and you say nursing, they'll know what to put down as your major. That's the first thing you have to do. The reason you have to do that is you want to make sure that your core classes will be covered by that major. So you have to go ahead and declare nursing your major, and they know what to do with that application. And then it will cover the courses that we've listed for nursing. Okay? Once you've done that, you fill out your application, you tested, we can sign you up. Okay, if you're currently enrolled for summer, that means you're already in the system. We just got to make sure you have the right major on your card. We can sign you up. The admission department is right outside the door here to the left. I think I'm right about that. Somebody can help me if I'm not. And they can help you with that today. We don't want you to leave if you're interested in nursing today and have not filled out an application or not signed up, because those courses are on their course descriptions ready to go for fall. The AMP lab is in the lower building over here to our left, which is also where the nursing classroom and nursing labs are. So it's the lower building to the left is where your biology lab will be. And it's a brand new lab. Dr. Dybert has worked excessively to have that lab ready with all of its supplies so it'll be ready for fall. Kelly McQuigg. You're going to see her the most. I'm just the nursing consultant involved in this to help them get their reports ready, to help them get their full approval. This is Kelly McQuigg. She is your program chair for the nursing department here. Okay? So her name and her phone number is in your packet. So when you call for information, you're going to get her. Okay? If she doesn't know, she'll call me. Okay? She has my cell phone, my home number, my work number. We have like this relationship. So it is all growing in process. Okay? And if you ask us something we don't know, we'll get the answer for you. Okay? We just want you to be successful in nursing. We want to make sure that you're on the right track. Ms. McCrigg will be sending out emails now that if you put in the correct email on that sign-in sheet, so she can keep you up to date with where we are in the process. Make sure that y'all are lined up in the right direction to be ready for January of 2020.